So, yeah, thanks for coming, guys, and again, a big thank you for Impatience, for all the help that you're going to give us. Everything and anything is going to make a difference, so we really appreciate you'll be out your comfort zone, but we really appreciate the kind of response that everyone's giving us, so that's cool, so thank you. And we're always glad for the help. So, this is like part one of the presentations I'm going to do, and I'm obviously covering taking observations and mobility as well. And we'll be using this Dynamap here. So who here has got absolutely no idea how to take any observations or read them on patient track? Okay, that's fine, that's good. Okay, so basically, in the good old days, in the 90s, we used to take the obs that get taken, they'd be written at the end of the bed, do you remember, and you could see it directly there and all the rest of it. But in the modern day now, in the last 5 years, I think it is, we've had Patient Track, or Patient Track 2 it's called, which is an app on the computer. I'll show you it on there. Basically, you click on it, and I'll go through how you take the obs and kind of your normal standardised readings as well. But taking the obs essentially forms the what I call a 4-point safety check before you go see anybody on the ward, and especially in the situation that you guys are going to be, you're going to be obviously like, where the hell am I, where things are, and we'll obviously try and orientate you, okay, to where things are. But in a nutshell, to check a patient's obs before you see them, they're always going to be on the desktop, on the computers on the ward, around there, and it's a little icon which I'll show you. Going back to the 4-point check before you see an inpatient, you check the obs, you always check the physio notes, okay, as well for the previous treatment session, unless you did that session yourself. This is in what we call the nursing cardex, so it's like a folder. It's in a separate load of folders. You'll see them all. They're pretty barn door. There's usually the medical notes on one side, okay, and then the nursing cardex is on the other side. It will all become clear, all right? This is why I typed it out, because there's quite a lot of information, but actually in reality, once you get your head around it, it's really straightforward. In the nursing cardex, there's also the nursing notes, which are always a good point of information for what the patient's actually been doing in the 12 hours that we've been not doing, sleeping, or what's happened overnight with the patient. But basically, check the obs, okay, check the physio notes, unless you were the physio that saw them, check the medical notes, okay. What you're looking for in the medical notes are what's the patient's current medical status. Are they medically fit and suitable for you to see? Please don't take shortcuts. Do not just look at the last entry and go, oh, it looks fine. Trust me, it happens to the best of us and the most experienced of us. You'll all get that white sick feeling when you just, I nearly, you have to know basically, what did that patient come in with? Are they medically fit now? Did anything happen in the duration while they've been in hospital? And yes, we do have patients having CVAs, falls, other fractures, PEs, all sorts of things happen. So you need to have an overview of what's happened with that patient. The majority are medically stable, but you do occasionally get people that have, unfortunately, fallen out of bed, things like that. Okay. What we'll also do is I'll get you the what we call the emergency floor admission notes in. That's where I usually start my kind of data collection when I'm doing the front sheet, but that's where you can start looking at what's brought the patient in and when. Okay, that's the other key thing. When was this patient admitted? And then hopefully in some form of legible handwriting or not, then you'll get a documentation of, PC, HPC, that kind of thing. Okay. And I'll show you that separately, otherwise we will be here all day, seriously. So is that okay? I mean, it's the usual, data collection for that patient. And we're really lucky, we've got some very experienced members of staff here. And look, some of it is very much common sense, and the majority is very, very interesting as well. Obviously checking that the patient's medically stable, okay, like I said. And the other key thing is the resus status as well. You ideally have an idea when you're going to go see the patient, is this patient for resus? The majority of our patients on Broadwater, the majority are over 90, and the majority of them aren't for resus, and you need to be aware of that just in case something happens. Okay, obviously that's covered in your mandatory training, but just to reiterate, I'm sure you guys are onto that already. So, 4-point check, OBS, okay, physio notes, medical notes, Nursing staff. Without the nursing staff, we're nothing. They're the glue that holds the units together, okay? Talk to them. They may even be, in this current situation, having a little bit of a panic themselves, okay? And just, you guys just doing a little bit of, I'm here to help, will make all the difference, okay? I was on the wards on Sunday, and there was a general feeling of a lot of anxiety. And as soon as I said to them, well, don't worry, in therapies, we've got a bit of a mission, we've got a plan happening, and MSK are coming. They were like, oh, and I was like, yeah, we've got a full-on plan. There's going to be people on the wards helping you out, and we're doing all sorts of things. So just doing that to the nursing staff will help, and they can talk to you as well, obviously, about what the patient's been up to, whether it's appropriate. Is that okay? But just don't. What I'm saying is, try not to underestimate the other skills that you're going to have, to kind of help with the staff as well. So, right. Anyway, back onto the nitty-gritty. Having a slight digression. So, checking onto patient track. So, hopefully, we're going to get you all access to patient track. The most straightforward way is to zap your card, your these cards that you all should have, and you just put it on the card reader, beep, and it does it, and then it usually faffs you around sometimes, but that should get you on. Have you all got one of these single swipe cards? If not, we need to make a little list and we'll get it sorted. It'll be fine,
It's the thing you use for the printer, isn't it?
Yes, yes, so, it is, yeah. And to check affinity and all the other cooler things like that, But yeah, if you zap onto that, and then the main screen will come up, and then you click on the patient track 2 icon down there. Do everyone know what that looks like? Just yet, no. I'll show you. I'll show you what it looks like. Okay. It's too small a screen to do it here, isn't it? So we'll click on that. You click on the ward thing. It's all written out basically there. What you do, how to do it, kind of straightforward style. You click on the wards on the top left of the page. Select the patient. And then scroll down. So it's pretty ABC on here, but again, I can show you in a minute if you like, if that would help. Yeah. Right. When you actually get up to your patient observation screen, when you actually get them up, what you'll come up with is then the whole kind of graph. You'll probably see a sheet, with the readings on there. There's some real key kind of things. It's a bit like looking at X-rays and radiology. Always check you've got the right patient. I've always had loads of people, including myself, that have done that. And make sure it's an up-to-date OBS recording. So the date should be right at the top. Can you see? It's really badly printed out, but right at the top there's a date. I know, get your glasses on. But there's a date there, and there's a patient name. Okay? Yeah, if you want to, go log on and get it up for us. That'd be great. Okay. I can take you through it, and this is again something from a buddying up system, which is what we're going to do with you on the wards. You'll go through with the person on there, okay? We look at news scores, okay? The kind of emergency scoring system is pretty self-explanatory. The colours that come up, guess what red means? Step away, probably. Green means go, it's that kind of thing. It acts as an early warning system for the outreach nurses and the doctors to review the patient. But once you've got through that part, we've got the actual OBS that you take, okay? So blood pressure, this everyone should vaguely know. What's a normal blood pressure? Yeah, exactly, yeah, it's your basic stuff. But what do you think, where do you think, when blood pressure changes, what factors can come into play? What could change your blood pressure? Yeah, oh yeah, nice. Yeah, very good, yeah, really good. Morphine, medication, stuff like that, yeah. Pardon? Fever, yeah. Yeah, Paula, you're on it. I want you on the seas with me. You'll be fine. Don't worry about that. I'll just be your minion. It's all right. They work for resources. You'll be fine. You will find other skills. So on the So basically, I've put the normal pressures on here. So normal blood pressure is roughly somewhere between 90 over 60, systolic, your diastolic, don't forget, to 120 over 80. This is all from the NHS website. High blood pressure is considered between 140 to 90 or higher, and lower is obviously below 90 or 60. But what you have to factor in, so like anybody new on the ward, you trot on there going, right, 120, 90 below. The thing is, most of the patients we've got in the hospital above the age of 65, which is the majority of the hospital, their normal values are all going to be slightly skewed due to comorbidities, surgery, medical issues. Some patients on the Broadwater lot, pro-stop patients, majority of the patients are normally hypertensive, HTN, and then they have all the meds stopped for surgery and then they start them, but sometimes they delay, so you get some really mega high blood pressures that can be a little bit concerning, but you just need to talk it through with the physio that you're working with and all the doctors as well. And the majority of the doctors are very, very supportive. So what you're looking for is trends, okay? What's the norm for that patient? And check the PMH. Because the other thing I come up against a lot, which leads me beautifully, is into heart rate. So your normal heart rates very, very roughly again are between 60 to 100. But I do start taking notice when people start hitting like 99, 100, because you're heading towards what's that heart rate wise roughly? Yeah, a bit of tachycardia. Again, a majority of our elderly patients are in AF, atrial fibrillation, or have some heart rate issues. And when we come bouncing up going, hi, we're going to get you out of bed, and this is before COVID, majority of our elderly patients looked at us very like, ooh, and they went tachycardic. I've had a few patients where it was just a specific physios that I went up to, and they went right up from like 80 to like 120, and like, you know, yeah. So you just need to put it situationally what's happening, because things that can affect heart rate, apart from excellent physiotherapy care and exercise, are what can affect heart rate.
Stress,
Yeah, absolute stress, cortisol, things, pain can affect it. Hydration, massive issue in the hospital with hydration, with AKIs, acute kidney injuries. If you get 5 minutes, have a quick look at AKIs online. We get a lot of our patients dehydrated. So all these can affect the cardiovascular stability of our patients. So please, I'll show you how to do all this as well, don't worry. So is that okay? So you just got to be mindful of it. Is this normal for this patient? Does it follow a trend? Okay. There is another issue where you will have to marry up blood pressure and heart rate. So on these lovely, when we've got it, you've got it up, Claire, haven't you?
It's only.
Oh, that computer is the.
I've logged in.
That's the one always to avoid. It's always avoid that computer. Your heart rate should ideally never be above your blood pressure. Okay. It's because it's without going into. I won't, because I'll probably say it wrong and Hayley will disown me. But we call it, kind of at grassroots level, we call it the bird and the poo effect. The poo should never be above the bird. So the systolic, the blood pressure should never be low, the heart rate should never be above the blood pressure, if you see what I mean. On the chart, yeah. When you plot it, yeah. It's never good if the poo's above the bird. That's. Yes, the birds, that's it. That's when you look at cardiovascular instability, usually, very, very basically. We'll show you on the chart when that computer decides it's going to play
If it
ball.
looks like a seagull doing poo, that's not good.
Yeah. So we'll show you, Sometimes with the orthopaedic patients, sometimes they're in AF, they're tachycardic. So I had someone the other day, it was 130 heart rate, the BP was 80/60. Did I mobilise them?
Yeah.
Damn right I did. No, I didn't. No, Roger Tozer would try and ask me to, but I was like, I did get called a chicken once, but it was fine. It was a different kind of time. No, just please be mindful of that, essentially. All right, we'll go through it a bit more because there's an example I've got on there that shows where the heart rate has actually gone higher. But you've always got to be aware of the pressure in the system, very basically. Temperature. Okay, so we all know the effects of temperature, sepsis, etc., etc. Normal temperature around 37 degrees Celsius. Fever is usually when your body temperature is above 38.8 or higher. I think the COVID guidelines at the moment for temp are, was it 37.8? Yeah, and it's on all the ward desks everywhere. I will try and show you how you take a temperature, but some of this we will have to do in situ a bit more. We haven't got a temp machine down here, but we'll cover that a bit more while we're working. O2 sats, right, some people, oh thanks Claire, oh cool, wicked, I'll do that in 2 seconds. O2 saturation, then remember what your normal target sats are? Yeah, roughly, 98, 90, it's up to 100. Yeah, again, it's what's normal for that patient. If you've got COPD, roughly 90 what? 88 to 92 to 94. But the key thing is look for clinic notes. Majority of COPD patients should ideally have been reviewed by, should be under a respiratory consultant or team or specialist nurse, and there should be some clinic notes with target SATs put down. Okay. Because one has to be a little bit mindful with, especially with COPD, for what? Can you remember what it is? Hypoxic drivers. So if suddenly you remember, oxygen is a prescribed drug in a nutshell. But again, you will not be making these decisions. Please don't worry about that. That's where your ward physios will kick in. But this is all what makes it really interesting, and one of the reasons I really like ward work. So one of the many. So you what? So
Someone's got to
you and me, Paula. Rocking it. Okay, when you are eyeballing with the SATs as well, just be a little bit mindful of the O2 delivery system that the patient's on, whether it's nasal specs, a Venturi mask. Sometimes the patients may be actually on the wrong O2 delivery as well. But again, all you need to do is think, I just want to run this past whoever I'm working with, because it looks like 2 litres with elephant tubing and a non-rebreathe bag on the forehead is not really helping somebody who's bright blue. It's as simple as that. A lot of it is, I mean, we're laughing, but honest to God, I've found that. These are just common sense things. That's not right, and so you just flag it up, and that's perfect. Okay. Let's have a look. Where are we now? We're nearly there, and we can actually start doing the interesting, relevant stuff. I mentioned about COPD, obviously bronchiectasis as well. Respiratory rate 12 to 16, again, but affected by pain, anxiety, exertion, performance as well. What's normal for that patient? You might walk somebody where their breathing rate, you look at them thinking, my God, this looks really hard work for them. But again, is this normal for you? They may say, no, it's not. I'm like, do you normally take any meds? Oh yeah, I forgot that GT.